Well, hello everyone, and welcome to LEMD's live educational series. We are so glad you're here to join us today as we continue our men's health series, where we take a deeper look at hormone optimization, energy, performance, and longevity, and what it truly means for men to thrive at every stage of life. At LEMD, we go beyond traditional telehealth. We're building a community rooted in education, innovation, and personalized support. This series is part of our commitment to equipping you with practical tools and evidence-based strategies to take ownership of your health. We're excited to welcome back Dr. Jason Pensek, an integrative health practitioner who marries traditional and functional medicine to deliver comprehensive whole person care. Dr. Jason began his career in nursing before pursuing advanced training in chiropractic medicine, peptide therapy, hormone optimization, and longevity-focused treatments. With over a decade of experience and a strong clinical emphasis on metabolic health and GLP-1 based therapies, he helps his patients build sustainable strength, vitality, and long-term wellness. Dr. Jason, welcome back. Thank you for being here.
Thank you. I'm very happy to be here,
Oh, well,
as
thank
always.
you. Thank you. Do you want to, for any new listeners, anyone tuning in for the first time, do you want to give us a little background on yourself and why you're so passionate about everything that you do?
Yeah. Um, I accidentally found this medicine. I didn't know what I wanted to do. And for some reason, I just thought that traditional medicine was really broken. There wasn't good outcomes with patients. So my friends asked me to find them um, steroids and growth hormone, as any good group of guy friends would do. And I accidentally found growth hormone peptides, things like testosterone and nipamorelin. And I decided that this was way more interesting than giving growth hormone. And I went to one of the first peptide seminars. This is 7 years ago. And I've just been learning peptide medicine since then. I was already doing IV therapy and hormones, regenerative injections at that point. And then I just layered in peptides. That's really become a mainstay of practice, even though I'd say every patient coming to see me does not really get peptides. I don't use them probably in everyone, but it is a big part of why people come to see me. So I use peptide medicine quite a bit. I think peptides are the future of medicine just in general. There's a lot of new peptides coming out. And currently, I think the ability to live longer and feel the best you possibly can is going to be through hormones and peptides.
Oh,
So,
I love that. And you've had your own personal journey too. You want to share that?
yeah.
Yeah.
Yeah, I was a little bit of a fatty. I was big, bloated, inflamed.
I didn't want to
Uh,
say it.
yeah, it's okay. You didn't have to say it. I was fat. And I thought I looked really good back then, actually. I thought I looked great. And, I decided I wanted to change. So I started utilizing all the things at my disposal. I'd already tried tons and tons and tons and tons of peptides. I tried everything I talked about in practice. When I've talked about something, I probably tried it. The only thing I haven't tried, I always joke, is estrogen. It's the only thing in practice I haven't taken for good reason. So I take everything, I try everything, and I was finally dabbling. I tried everything, and nothing really changed. And then I finally decided this is it. I'm ready to move forward. I started taking testosterone, which is one of the things we'll talk about today, and really improved my overall well-being, how I felt. And I think, as we all understand, when you're sick, when you don't feel good, when you're tired, you're fatigued, you have a cold or a flu, you're not looking for healthy things. You're looking for, what can I do to do nothing, to sit around, and to just feel better, look for some kind of improvement of dopamine. So we're not looking for really healthy options. We're looking for high carb, unhealthy things when we're sick. And so that was it. I was sick. I was sick and inflamed, didn't feel good, and I was just doing whatever I wanted. I was eating gummy bears for breakfast, the really, really healthy, nutritious breakfast, gummy bears every day. And I just didn't feel great. And then between testosterone and growth hormone peptides, and then a little BP157, kind of shifted everything for me. I started working out twice a day, every day. And now I have the energy to do that. 4 years later, I'm still pushing myself to usually 2 day workouts, except here in Rio. But everywhere else when I'm home, I'm working as hard as I can to keep my body going. And again, utilizing all the peptides and all the therapies I have in practice to keep myself going. So I lost all the weight, got shredded, brought my inflammation down, and now I pretty much feel great every day. Every so often, like right now, I get sick, something happens, the immune system doesn't work all the time, but That's why things like Dimethanol one to keep us going. So there are all these options in peptide medicine. And I always say there's peptide for that. No matter what someone comes in for, there's probably a peptide that can help treat that. So I utilize everything I have at my disposal to kind of keep myself going and feeling the best I can so I can get into my 60s and 70s and still look like I'm in my 20s, hopefully.
And if you haven't seen a before and after photo of
Uh,
Jason, make sure you check it out on his social media page on his Instagram, Dr. Jason Pensek. Go check it out. I mean, it's pretty incredible
yeah,
done
I had
with
my
your
hairline
body.
was receding, GHKCU. Oh my God, just all the peptides. So
So it works. That's how we know
it
it works.
works. It works.
Um, Dr. Penza, can you tell us why men begin noticing a decline in energy and performance when they hit 40s, their 40s and 50s? What ends up happening in that age group?
Yeah. Well, you have to remember, as you get older, everything stops working as well. I always tell people that 26 is when you stop growing. That's when your brain stops developing. And everything after that, we're just maintaining. You can build more muscle, you can build new synapses in the brain and learn new memories, but you're not going to grow anymore. There's no growth. Everything's maintained and holding as much as you can. So as you get older, hormones start to decline. You start to see decreases in growth hormone. You see decreases in testosterone. You see decreases in thyroid. All these things are going to start mattering as you get older. We also see things like insulin resistance starts in your 40s. You've been eating these kind of unhealthy snacks, foods, garbage for all these years, and everything just adds up. Being 41 now, it's an awful thing to finally get into my 40s. I was so excited to not be 40. Now I'm here. And I think that what a lot of men are missing is um, partly hormones. It's a big part of it. They're also, not having sleep deprivation is a big part of this. People are not sleeping as well, right? You're a man, you're maybe running the household, you have a lot going on, you have a lot of stress, your focus is on other things. So, your stress management isn't good, your sleep isn't good, leading to, insulin resistance, even further down declining hormones because you're not sleeping as well. Um, Now your blood vessels aren't working as well. Endothelial dysfunction, you're starting to have changes in blood flow and how much perfusion, how much blood and oxygen can around the body. So these are the big core things, right? We want to work on hormonal improvements and fat loss. We want to get that visceral fat down. We want to help it change the insulin resistance, and that's what we're doing every day with hormones and GLP-1s, which is pretty much what I do in practice all day, every day. You get to
Jason,
that age,
sorry, can you explain insulin resistance to
for
people?
sure,
Because we keep hearing it, but I don't
for
think
sure.
everyone understands what that really means.
Yeah, for sure. So, insulin resistance. Basically, what happens is there is some amount of sugar in your blood at many times, usually like 5 grams. Very, very, very small amount is sitting there, and it's traveling around your body at any given time. And what's pulling in the most is typically muscle. It goes in muscles. Your muscles pull it in and get to use it, and then it stores in the muscles. It stores in your liver. Brain is one of the biggest areas of pulling these lots of glucose and sugar to run. So what starts to happen is the first sign of insulin resistance is insulin changes. So usually when we look at labs, I look at insulin in every patient. When there's a certain level, for us it's 5, I believe, it's nanograms per deciliter. Can't be exact, but it's 5 level. And anything above that starts to be insulin resistance. Basically, how much insulin you need in your blood to push that sugar into the different cells, into the muscle, that is what we really care when it comes to insulin resistance. As that insulin level starts to go up, you have to use more and more insulin to cover how much sugar is in your blood. So the first thing typically happens if you're seeing someone before your hemoglobin A1C, which is a blood sugar level, even rises, you see insulin go up first. So all patients that come into my office, their insulin is maybe 4 times the top level I want it to be, but their hemoglobin A1C, their sugar level with their blood sugar level at any time is still good because your body's producing tons and tons of insulin still to push it in and keep that level down. And your body's doing that all the time. If you eat a meal, you increase more insulin. It pushes that into the cell, and then your insulin levels go down. But at some point, when you're fasted and insulin levels start to go up, you start to get this insulin resistance. Okay, so insulin's going up, but you're not able to keep that blood sugar down. Eventually, your pancreas says, "Hey, I've been making all this insulin. I'm done doing this as much. Screw you, body." And then the insulin kind of drops back down, and now your blood sugar starts to rise. You start to see hemoglobin A1C start to go up, and that moves you towards that type 2 diabetes. So basically, insulin resistance is your body's resistance to pushing that sugar into your body because you've overloaded the system for so long that your body can no longer handle how much sugar you've just been bringing your diet. Body says, "I'm done pushing that much insulin all the time."
And what ends up happening? What does this lead to besides
Oh my gosh. Type
diabetes?
2 diabetes, yeah. Endothelial dysfunction, so blood vessel dysfunction. You start healing doesn't go as well. When you think of diabetes, we think of excessive weight gain. We think of poor health, poor repair, poor immune system. You start to have diabetic neuropathy. You can lose nerves stop to work as well. They can get destroyed. So there's a whole host of things that happen with type 2 diabetes, which is extremely preventable. It's really just monitoring what you eat for food, what your diet's like. If you're not eating the amount of protein, I'm sitting here right now with my protein actually, some little protein here. So if you're not eating the amount of protein every day, you're eating more of these heavy processed carbohydrates, which is what we see in the grocery store, right in that middle area. I always tell people stay away from the middle area of the grocery store as much as possible. That's all processed garbage. You want that outside, right? You want to go on the outside. Anything that's going to be fresh is on the outside, has to be kept cold. And those are the type of foods that are typically going to keep your insulin resistance from going up. Again, fruits are sugar, but because they have so much fiber in them, they're going to slow down how you absorb, which then reduces the hit to insulin. So, did I answer the question? I went off track.
Thank you. Thank
Okay.
you. Can you share with us what the first and early warning signs are of something being wrong with your hormones?
Yes, you're tired in the afternoon. If anyone out there that's starting to get tired in the afternoon, like, you hit that maybe 1 o'clock, 2 o'clock, 3 o'clock slump. This is for both men and women. A lot of patients come in, I'm like, I'm just tired in the afternoon. I feel like I could need a nap. I feel I'm a little exhausted. That was my first indication something was going on when I first started taking testosterone at 31. I was just tired in the afternoons. Into my day would come and I'd just be reading to just go home, close my eyes for a little bit and just do nothing. That's the first thing typically happens. You can see the loss of drive, motivation. That's a big one for men as well and women. The motivation goes down. So testosterone helps improve dopamine, and dopamine increases how much drive you have to get things done, to do things, to go exercise, or maybe be better at your job, or take better care of your family, whatever the thing that you're driven for, that starts to go down when you lose testosterone. So, you also see brain fog, recovery is not as good, you're a little more inflamed, more fat around your belly starts to happen, the libido starts to go down, sleep isn't as good, and then your resting heart rate tends to start going up. So you look at if you have an Aura ring or a Whoop or whatever you used to track, you'll notice all of a sudden my baseline heart rates, maybe it was in the 50s before, maybe it was in the 60s, and now it's in the mid 60s, starts drifting up. So again, these are all things we see. And again, this is not just testosterone; it could be growth hormone as well that's going down that could be causing this. So those are the two biggest things that people will see, or the two biggest hormones I see coming down as they age. Testosterone goes down about 1% a year in men after age 30. So you start to lose your hormones pretty quick. And testosterone has decreased about 40% over the last 20 years in men. So we went from an average male testosterone of 700 to an average male testosterone of 450 nanograms per
Stop
deciliter.
it.
Meaning,
That's
yeah,
tragic. Wow. What's causing that? Is it the plastics, the microplastics? Is it our environment, our food, obesity,
everything. And
everything?
obesity is probably number one. Right now, that's the big thing, right? Where if you look back at pictures of people in the 90s, right, the obesity wasn't as much going on. There weren't people who were so obese. You have to think processed food has become easier and easier to get. As processed food has become easier to get, people could just go grab instant sugar. You used to go to the bakery and have like a baked goods to get the sugar, to get these extra sugars and everything. Now it's so simple. You can walk into a 7-Eleven or CVS, Walgreens, or name a place that you go, a convenience store, and you can just grab some. Hey, I'm hungry. And you're just thinking, I need to eat something to eat. You're not thinking of, well, what should I get that's quality? And I always tell people, if you are hungry and you're really hungry, you'll want protein. They'll be like, you'll be like, hey, protein sounds good. If you're not hungry enough to sit down and eat protein, you're really not that hungry. You're just looking for some snacks. So in that case, go grab some protein. Go in that 7-Eleven and grab some beef jerky if you want to. But I really try to stay away from any kind of processed sugar. And not that, again, I'm saying it's the worst in the world for you. It's all moderation, right? So we have to have things taken in moderation to improve our overall insulin sensitivity, and then to just kind of improve overall how we feel. So obesity is a big one, number one. Poor sleep, more stress, microplastics, these are part of the things we have going on as well. There's a lot of things, environment have just changed, and that huge drop is going to keep dropping. We see dropping by about 1% a year.
Yeah.
So, honey, your children are going to have lower testosterone than their grandfathers are, and this keeps going down and down. In
No,
fact, the
now we have
second thing,
peptides. Jason, we have peptides. We're going to fix that. We're going to fix all of this. But
sure,
I've
we got
also
obesity
heard,
under control.
well, I've also heard birth control has had a lot to do with the decline. Of course, you men had to blame us somehow. That women being on birth control is causing the decline in testosterone levels. Have you
Well,
heard that theory?
hold on, it is actually causing them. Women on birth control will have lower testosterone and higher sex hormone binding globulin. So sex hormone binding globulin, SHGB, is exactly what it sounds like. It's going to bind to whatever sex hormone you have, such as testosterone, and pull the free testosterone out. So women on birth control do actually have lower free testosterone and lower testosterone overall. I had a 19-year-old practice probably a year and a half ago whose testosterone was basically zero. She's 19. How do you have an 19-year-old with no testosterone? Well, she's on birth control. And of course, every time I ask women why they're on birth control, if it's not for managing actually birth control and it's used for, like managing my cycles, I'm like, well, there are other options to manage cycles, such as progesterone, working on something that does hormones. We can do other things that are just giving birth control. They did a big study years ago, honey, and they found women who are on birth control prefer a different kind of man or different kind of partner than someone not birth control. And the big reason for this is lower testosterone. When you have a lower testosterone as a man or woman, you're looking for someone who's going to match you. Someone who's like more low energy, who's not really out there doing a lot of things. They're not pushing themselves because you're that way. And you want to have someone that matches you. So they took women off birth control, and all of a sudden they want different partners who are more outgoing and want to do more and want to kind of explore and be adventurous. So I always tell women, if you're on birth control, see if there's another option for you, or at least get your hormones checked and see if you need testosterone while you're taking birth control, because I'll supplement that to my women. So it's not entirely a fault. We have lower testosterone in men, but women, you have low testosterone from being birth
I
control.
heard that it was our fault that men have lower testosterone because women are on birth control. The men just know that.
Yeah, we'll just blame you for everything. It's
I
fine.
know. There you go. Well, talk to us about the decline in growth hormone as
Okay,
well.
yeah.
Yeah.
So growth hormone starts to go down about 15% a decade, when you get into your 20s. So by the time you hit 60, you're at 10% of the growth hormone you made when in your teens. Well, what does this mean? Growth hormone controls a lot of things. It controls your brain function. It controls your sex drive. It's going to control your mood, your sleep, especially sleep. People who have a lack of sleep, growth hormone, improving that really can be useful. It's also going to improve your fat loss, your muscle gain, your skin, hair, nails. It's going to help your motivation, your energy, immune system, repair. It kind of covers everything. We call it the jack of all trades, master of none. And that starts to go down both in men and women. So men are experiencing this lower growth hormone. They're not feeling as good. So I could put men on testosterone all day long. They will feel a little bit better. It's not really till I pair it with something to improve growth hormone that I see, wow, oh, well, there's a huge change here. In fact, I can give just growth hormone. I can tell you I did both myself. To growth hormone, I took testosterone. I did testosterone first about 3 months, came off, gave it a month, got on growth hormone peptides. I would say I was probably 90% of the energy I had on testosterone on the growth hormone. So I still felt really good on growth hormone. Combining the two just gave even better, overall synergy. So growth hormone is a massive improvement from then. If you haven't considered growth hormone peptides in any way, shape, or form, improving growth hormone would be really, really useful. And you can improve growth hormone just by improving your sleep. So if you can actually get better sleep, you can improve growth hormone and testosterone. The problem is it's a vicious cycle because as growth hormone goes down, testosterone goes down, sleep gets worse. So then you have to maybe figure out a way to supplement testosterone or growth hormone to improve that. And again, these levels are declining your whole life. So the testosterone you have today will not be the testosterone you have in 10 years. It'll be lower in both men and women. Same with growth hormone. The numbers just keep going down. This is the body breaking down slowly. So you just got to figure out ways to kind of bring us back.
Okay, so besides sleep, are there any other natural ways to increase growth hormone and testosterone before we talk about TRT and peptides that we could supplement with? But are there other natural ways
Mm,
to increase these two?
yes. Honey, do you go to the gym?
I sure do.
Okay. Okay, look at those biceps. Lifting weights, doing weight bearing exercise, really doing strength training is one of the best things you could do other than sleep. Sleep isn't really improving, but if you want to go to the gym, workout, diet, if you are obese, you're also going to have a lower level of testosterone. So losing weight is going to also improve this. So, what can we do? We can definitely, help with insulin resistance, which is going to change things. We can help with sleep. We can help with going to the gym. We can help with nutrition. There's lots of things you can do before you even add peptides in. It's not that the peptides and the hormones are everything, right? You want to get someone to doing better. And I've had patients come to see me. We've given this them to help them get in the right path. And then we'll pull them off and retest them. Hey, we want to do this for a little bit. We want to get you back on the path of taking testosterone, maybe taking some growth hormone peptides, and then we'll pull them off. How do you feel? And they feel somewhat better. Labs come back looking a little better. But ultimately, as we age, like I said, the levels just go down. That's just simple as it is. There's nothing I can do. They just slowly start to decline. That is unfortunately what happens. Now, again, you can do all those other things. You can optimize as much as you want. There's some supplements you can use as well that might get man maybe 100 to 200 points of improved testosterone levels. But when we're talking about men's testosterone, we want them in the range of 800 to 1,000 nanograms per deciliter. And again, the average is 450 now. That's a long span. So if I can get you 200 points from 100, 200 points in supplements, you're at 650 now. That's when I started testosterone. My testosterone was 650 and I felt terrible. So I have men come into me and I'm like, oh, your testosterone is, 700, 650. Do you have symptoms? Of course, if they have symptoms, we're going to treat them for it. We're going to get them back to where the 800 to 1,000 is. There is a range, right? Not everyone feels the best at the low part of the range or the high part of the range. Everyone's physiology is different. So we have this range so that we know kind of in this range, you might feel better, but we can even push a little further. Hey, you get to 800 for a man for testosterone. Great, let's go higher. You don't feel that much better yet? We can go higher and see how you do. So everyone kind of feels how they do. And I'm always recommending diet, exercise, sleep, to improve everything. But then beyond that, we have tools to help us. Sometimes it's just not enough.
Okay, let's talk about peptides for increasing growth hormone and testosterone. Let's
Yeah.
talk to us about that.
Okay, so growth hormone. If you don't know testosterone and ipamorelin from LEMD's lineup, that is the top dog in the room. Testosterone is about 4 times stronger than CJC 1295, which is like the step below it. And then compared to sermorelin, it's about 7 times stronger for growth hormone. What really matters is how much IGF-1 testosterone pushes out. Ultimately, IGF-1 is what we're trying to bring in downstream to improve how we feel. So testosterone has the strongest IGF-1 push, which then also means it has the most adverse effects. This is the other thing people have to worry about. When IGF-1 levels rise, you see improvements in sleep and brain function, everything else. But the opposite side is you start to see more water retention. So about 20% of people that start testosterone will get water retention. So if you've got water retention, it can happen. About half those people after a month will have the water retention subside. And then you go back to just feeling great. So testosterone is the strongest one because that you get, again, water retention, more possible carpal tunnel because there's more swelling, more joint pain because it's swelling there. That's like the big things we see from testosterone, ipamorelin, or just testosterone alone. If you've potentially come away with maybe some of those adverse effects, the first thing I do with patients is drop the dose down, see how the dosing goes down, because again, it's just the strength of it. And then second off, I might switch to sermorelin. This is not working well for them. We'll go to something else that's a little bit weaker. I've had patients who swear sermorelin is the best peptide they've ever taken. They've tried testosterone, they've tried CJC 1295, and they just think that sermorelin is the best for sleep overall and how they feel. Though if you look at the actual data, testosterone still wins overall. So testosterone and ipamorelin is the one way to reach, and sermorelin are all ways to improve your growth hormone. What they're going to do is your growth hormone releasing hormones and growth hormone releasing peptides. So growth hormone releasing hormone is going to be sermorelin and testosterone. They're going to go to the brain, to the pituitary, and say, hey, release more growth hormone. That's it. Very easy to do. And testosterone is just stronger at attaching to the pituitary to get somatostatin, somatotropins, like basically release more growth hormone. As you age, there are cells in your brain that basically release growth hormone. As you get older, these cells go dormant. Some of them die off, some of them go dormant. And why they're going dormant is because there's no more signaling. Your signaling declines as you age. That's the thing. Signaling goes down. Think of this as a fan in the room, and every hour the fan gets louder and louder. I'm just screaming over the fan to get something out there, to get the signal out there. Testosterone is going to basically be that signal, the screaming, maybe a bullhorn that gets me to talk to the body. And so it's just going to signal the body, make more growth hormone. So all these dormant cells that have gone, quiet are going to come back online. So now you're producing that growth hormone you were making, and you're not going to make the growth hormone you made as a teenager. Just not going to happen. But you could pick these levels up significantly from where you're at. So people do see improvements in all these different things. So I will say that the big thing is going to be using the testosterone to help improve growth hormone output. Now the ipamorone is going to be the growth hormone peptide, and ipamorone is going to be working on the brakes. So we have the gas, which is going to be the testosterone, and we have the brake that we're taking off ipamorone. Ipamorone pulls the brake off the pituitary, so now you can release more growth hormone. So now we have the gas, release hormone going down for gas, and we have the brakes coming off, and now you have this kind of car moving forward, so growth hormone can be released uh, pretty well. Again, the best thing about the growth hormone peptides I like is it doesn't shut down your own production. It's just going to boost what you have. And then when you come off, you just go back to where you were. There's nothing going wrong with that I'm worried about because I'm just boosting the function that's happening. So I love the growth hormone peptides. Again, as we age, we lose growth hormone. There's absolutely no reason not to consider these unless you potentially have cancer growing. That's the big one, or had a history of cancer sometime recently. But growth hormone has done so much with patients in practice, done so much for me. Um, I've just kind of learned this as we're going along. The best things I see in practice are going to be GLP-1s, your growth hormone peptides, and testosterone. Those are the top three things I'm using in practice to see real improvements in how patients feel day to day. So,
Oh, sorry. Can you just touch on the cancer growth? Because I
yeah,
get the question quite a bit, and we talked about it earlier. It doesn't cause cancer. Can you just elaborate a little bit more on this
yes, yes, yes.
question that
I
comes up
almost
all
said
the time?
I I almost said sim, which is yes in Portuguese. I'm so used to speaking in Portuguese now. I think I'm actually becoming Brazilian here, honey. I think I want to stay down here. It's beautiful. Um, so yes, um, there's no increased risk of actually getting cancer from these things. What's going to happen is you're going to potentially grow cancer. So if you have cancer present and it's growing already, this is going to push it further forward. So things like NAD potentially can also grow cancer. Things like BPC-157, thymosin beta-4, GHKCU, these are all things that potentially can grow cancer. And I mean grow active cancer. It's not like you're going to be taking these things and all of a sudden you'll be, oh God, you found you got cancer. That's what caused it. It's not the cause of cancer. It will just grow what's there. And growth hormone is definitely known for that. It's growth hormone. Growth is exactly what we're saying here. So it's going to grow anything that might be going. So am I doing cancer screening on patients? I'm doing labs on patients. I'm just looking to see what be going on. It's really hard to see. Um, it's really hard to see what might be going on in just lab work. There is Pronovo and there's Grail testing. Grail is using blood spot. Pronovo is a whole body MRIs. These are experimental. There's some data suggesting it could be really useful. There are people I've heard and known, like patients of mine who found something before they would have found it any other time by getting Grail done or Pronovo. So it's potentially useful if you want to know if you have cancer, but it's not a requirement for me to do because these tests are not 100% accurate. So I can't say this is exactly what's going to be happening. So I do just want to remind people, you don't have to worry about the cancer thing. The median age of cancer is your mid 60s. So most who had cancer when they're much older. I believe most of LEMD's patient base is somewhere probably in the mid 30s to probably in the 60s range. Um, and that age range doesn't really have very often any kind of active cancer growing. And not that I'm saying it doesn't happen. I'm not saying at all it's unlucky. But in general, they're not going to cause the cancer. They'll just potentially grow what you might have. So if you have cancer, please don't take growth hormone peptides. Absolutely not. Not okay.
Yeah, and let's talk about visceral fat and
Yeah.
testosterone and visceral fat. So it was FDA approved for HIV patients who have
Yeah.
lipidemia, and it's effective, very effective for. Can you talk to us about that? How does it work? What's the mechanism of action here?
Well, here's the thing. Growth hormone goes down, you get more visceral fat. That's literally talked about in your 40s and 50s. Said, how does this happen? What happened with men? You just get more visceral fat as you age. This is part of the aging process in general. Growth hormone goes down, visceral fat starts to go up. When we give you testosterone, we're raising that growth hormone level back up, which means we're dropping visceral fat by up to 20%. So visceral fat goes down. Now, visceral fat is the fat around organs. This is really dangerous for us. This fat around organs is what leads to the higher risk of heart disease. We don't want that to happen. So visceral fat we want to keep down by keeping growth hormone up you keep visceral fat down. When you stop taking testosterone, here's the thing: that visceral fat slowly starts to creep back up because that growth hormone is what's driving it down. So I'm a big believer in using growth hormone long term. In fact, they have a study, 26 months in humans, and people ran testosterone nonstop. Right? They've done this human study showing that you can use this long term. In fact, it was meant to be used long term. Right? These are HIV patients. Let me tell you, HIV is not like it was in the 80s. You don't just die from it. You get HIV and you live another 20, 30 years. So these people get on this, we call it actually Grifta is the name of the drug, testosterone. They get on a Grifta and they're there forever. They just basically keep taking it. There's no reason to come off because they come off, again, that visceral fat comes up, all their blood work changes, they don't feel as well. And the drug cocktail that they're taking actually increases visceral fat even more. So I'm all about telling patients, hey, testosterone is one of these ones, like long term. Maybe you'll cycle it, maybe you won't. Cycling can be done. In fact, a lot of practitioners will cycle it. Again, after reading the studies on it, I'm less inclined to force cycling as I used to do. So I do see testosterone based then used long term. Again, the whole point of this longevity medicine, what we're trying to do, and what Ellie has helped create is how do I get patients to do something long term for us? And when it comes to longevity, how can I feel as good as I do today and feel that good in the next 10 years? Or if I come in to see you for the first time, honey, and I haven't felt anything, I feel crappy right now. How do I raise you up? And how do I hold you there when I get you there? And everyone always says, well, how am I taking this for? How am I taking this growth hormone stuff for? How am I taking the GLP-1s for? How am I doing this for? Well, I mean, women, you guys understand longevity better than men do. Many of you probably do some kind of skincare routine. I guarantee you, honey, you do some kind of skincare routine every day. I'm sure you don't just wake up and like, well, my skin looks pretty. I'm good to go. Let's go. Exactly. There it is right there. See, there you go. So you're using some stuff. So we're already using some kind of skincare routine. And women, you get this. This skincare routine didn't just start last year, many of you. It started probably in your 20s. Some people probably did Botox during the 20s or early 30s, right? People doing preventative, women have been doing preventative things for years. And if I ask a woman, are they going to stop taking whatever skincare routine they are? They've left me out of the room. Absolutely none of you are going to quit. You're going to get to your 60s and still be doing your skincare routine. You're going to get to your 70s, still be doing skincare. It might change. There might be different things you move in, but you're always going to care about this. Do you know how many men take care of their skin? Like very, very, very low percent. Women out there, how many of your men have some kind of skincare routine? Almost none, right? And our faces show it. Our faces age a lot faster than women in general because we don't do anything for it. So when it comes to longevity, women already get it. You're already doing something for yourself every day for your skin. Well, what else should we be doing for this? Well, we should be exercising every day. If you start exercising after, 3 months of exercise, you go back to not exercising at all. What happens to your muscles? They go back down. So this when I think of testosterone or I think of growth hormone and I think of the hormones, they're down. The only thing you can do is hold them up as long as you possibly can, and that's it. They're not going to come back. They're not magically. You're not going to turn 65 and all of a sudden the hormones you had at 40 are going to get even better. It's just slow decline. So my thought process is what's the least amount of things I can give any person that they can maintain long term? Otherwise, you're not going to do it. Compliance is huge, right? Why does LED not have 1,000 things for everyone? There are many peptides. Why is it more locked in? Because these are the things that we see working, right? We see GLP-1s helping. We see testosterone. We see growth hormone helping. Do you have to be in growth hormone forever? Potentially. I mean, if you want to keep feeling good, do you have to be on GLP-1 forever? Some people want to. They see lower inflammation. They feel better on it. But I don't tell anyone they have to be on a GLP-1 forever. It's not a requirement for me, but microdosing is super useful. Going at a low dose and holding there can be useful for people. There is research supporting it can lower the risk of major cardiovascular events by up to 20%, even in people who might already have a lower BMI and have lost the weight. So to make a long story short, all these things can be used, a lot of them used long term and should be because the thing is our body is aging and breaking down. All we can do is hold ourselves there as long as we humanly can and maintain where we are. You're going to keep breaking down. Maybe at some point your skin's going to get more wrinkly. I mean, like GHK only works so well. Your skin can work so well. But if you're doing something to hold it, you're going to hold yourself there feeling good. Health span, lifespan. What we're trying to do is extend lifespan and expand health span. How long we feel good for. I don't know about you, honey, but I want to feel good till I'm in my 70s. Look, Schwarzenegger, look at the guy. That guy is still muscular. He's still fit. He's still doing things. Like he's still active. Like I want to be that. I see RFK. This guy's jacked. He's going and working out. Like I want to maintain that physique and how that feel for many, many, many years to come. And there are certain things that I have to do for that. Again, for me, peptides and hormones are the best way to optimize myself.
Okay, quick question. And I want to close the loop on testosterone and growth hormone, and then we can move
Yeah.
on to some of the other things that people care about. So, in what case would you use growth hormone versus a GHRP and GHRH? Like, why would you want to opt in for a GHRP, GHRH, like tesamorelin, ipamorelin, samorelin, versus just taking growth hormone directly?
Mm. Not a fan of growth hormone. I'm not a fan of growth hormone because, in general, growth hormone has um, one isoform of growth hormone it gives out when you get a traditional pharmaceutical growth hormone. So here's the thing, your body naturally produces multiple isoforms of growth hormone, basically multiple snippets of what growth hormone looks like. When you give just growth hormone by itself, insulin resistance can get worse. When we talk about insulin resistance is bad. We don't want insulin resistance. That leads to more heart disease, diabetes, like these not good things. Giving growth hormone peptides gives multiple isoforms. There's a separate isoform than the one given in growth hormone that actually can prevent the insulin sensitivity from happening. So that's one. Number two, I can shut down my own body's production of growth hormone. So if I come off growth hormone, it's like, well, now what do I do? Well, your body's not making it anymore. So good luck. Hope you do well. So when I transition people off growth hormone, I typically give them like a few weeks span between coming off growth hormone and starting growth hormone peptides. They come off one, I give them a few weeks to put them on something else. Here's the thing. You're probably not going to feel as good on growth hormone peptides as you do growth hormone. Any bodybuilder will tell you this. Of course, giving super physiological, meaning way higher than the body makes growth hormone is going to feel better than just, giving the thing that's going to raise your levels back up to where you're at. Using tesamorelin or ipamorelin, any of these things that we have out there, sermorelin, they're going to raise you as far as your body will let you produce it. I can only produce so much. If I give excess growth hormone, just growth hormone, I can give any number I want. I can give a ton of growth hormone and just do what I want. It's like giving exogenous testosterone. I can just keep giving it to you and giving it to you. Who cares? Your body's not making it. I can just give it. So one, it can shut things down. Two, it can cause insulin resistance. And three, the thing about growth hormone is growth hormone can also lead to more water retention. When I said testosterone has the most water retention, well, guess what? Growth hormone has even more because it's pushing IGF-1 even more. So you have even more water retention. So because of those reasons, I don't touch growth hormone. It is a rare instance. Potentially, if I have a child who doesn't have the height they want, and I look at their, certain markers, I'll say, hey, okay, we can maybe use growth hormone. Your levels are low. We can do this to improve your growth. Fine. That's the time I use it. Patients will ask me for it, and I'm not opposed to saying no to them, but I've got to cycle it. I definitely make people cycle growth hormone. I don't use that forever. Whereas testosterone, I'm like, I'm not really worried about this, but I am worried about using growth hormone long term in patients. There's also a higher and faster growth of cancer. So anyone that's worried about this cancer aspect, well, growth hormone is going to push cancer even further than just giving testosterone. So a whole bunch of reasons, but overall, I think growth hormone has a good time and place. Maybe when someone's in their 60s and 70s, but I can't even tell you that because my mom is 80 right now and she's on growth hormone peptide. She's on testosterone. She feels good. So I can't even say that. You're going to produce less growth hormone with using the peptides as you age because you just have less cells that are working. So giving growth hormone at some point for people when they get older, maybe when you're 85, 90, sure, maybe growth hormone might be a better option. But I'm never thinking that because now I'm 85, 90, and my cancer risk has gone up. The older you get, the higher the cancer risk. So why am I giving growth hormone to someone that's already at a higher risk of cancer? So personally,
Okay, and but testosterone doesn't have the same fate. So
no,
you have
God,
to,
no.
okay, no, but you have to supplement with TRT, right? If your testosterone levels are low, you've tried exercise, you've tried all sorts of natural supplements, and you just can't
Mhm.
get back up. We have to supplement with. Can you talk to us about enclomiphene? When would you use TRT versus enclomiphene? Can,
Um, well, I really hope LEMD one day gets enclomiphene, but until that day, enclomiphene is great because enclomiphene works on the HPA, hypothalamus pituitary axis up here in the brain. What it's going to do is basically tell your body to produce more LH and FSH. That goes down to the testicles. It's going to work on two types of cells in the testicles and basically produce more testosterone. It's going to make your body produce more. So you're just naturally saying, hey, make more of this. By younger men, typically up to about maybe 45, 50, I'm using clomiphene because I can just reset the actual growth hormone. Sorry, testosterone. When I get past 50s, the cells don't work as well. They can't pull it in. They can't work as well. They're just unfortunately, the signals don't work. So when you give enclomiphene, you just can't raise testosterone as far. What I'll typically do is, in fact, you can actually start enclomiphene in a male, run it for 3 to 6 months, stop it, and might have reset the hypothalamic axis, and they might be able to produce on their own. So I can give men clomiphene and restart their system, come off, and then maybe like they stay high, and maybe in 6 months they need it again, for a few months. I will typically use testosterone in men that no longer want kids. So when you still want kids, maintain fertility is really important, and clomiphene can help with that. Testosterone is going to shut down sperm production in men. We don't really want that when you're trying to have kids. So in that situation, I would say that I start to use TRT in men who've already had kids. They don't want to have any more. If I give enclomiphene and I give testosterone, the men that take testosterone do tend to feel better than the men on enclomiphene. We get to the same levels. I think part of the reason why enclomiphene makes you not feel as good is it does lower IGF-1 levels. So this is where you might have to give them testosterone to counteract what the enclomiphene is doing. So patients on clomiphene, same level as testosterone, TRT, they'll tell you, I feel better with the TRT. So I would prefer TRT in most of my men if they want to do it. The clomiphene is more for patients that are younger, want to hold their sperm count, want to maintain fertility, and aren't ready to shut down the production of testosterone. Now, you will shut down on TRT, can come back when you come off, so it's not a permanent shutdown. But if there was a man that had taken TRT for 10 years and a man who didn't, the man who took TRT for 10 years and came off is going to have a lower baseline testosterone than the guy who never did anything. But again, over 10 years, you've still dropped. So both these men have lower testosterone over 10 years. It's just this guy that had the testosterone TRT is going to have a little bit lower level than the other guy. So I do tell men, yes, that's what we see. If you ever come off, you would a little bit lower than you would if you had done anything. But I mean, subjective. You have dropped, by 50% your testosterone over 10 years. Really doesn't matter. I mean, 50% lower, it doesn't matter. If you're at 100 to 200 or 300, you still feel like crap. So, mostly I use it for men. TRT is most useful when I see men who want to come in and done having kids and don't care about fertility.
Thank you for explaining that. Okay, let's talk about some of the aesthetics. We have a lot of men that ask about hair loss. What are some peptides? What are some treatments that are great for hair loss?
Mm, yeah, Menadixel is a very common one people like to use. Rogaine. Unfortunately, when you stop, your hair stops growing and falls out. GHKCU actually can also improve hair growth quite a bit. It's a copper peptide. That one, when you stop, the hair doesn't fall out. So they found in some studies that the hair growth is similar, equivalency, from using GHKCU versus Dixel. And yet one of them you don't lose hair after you stop, and the other one you do. So GHKCU is my favorite peptide for skin, hair, nails, just hair in general. Some good data on that. The other one right now, a lot of men like to talk about is finasteride. A lot of men start to get male pattern baldness. They want to be on finasteride or dutasteride. These are two of the most common um, DHT inhibitors. What they're going to do is block DHT from forming, which is a downstream hormone from testosterone that causes inflammation at the hair follicle level. Finasteride can cause erectile dysfunction. So now you have the next problem that happens. So, give one drug, have the next problem. There are topical formulations of dutasteride and finasteride. Typically, dutasteride has a lower risk of that erectile dysfunction problem because it's a bigger molecule, harder to get into the system, and it's topical. So there are a lot of men. There's a whole article I saw on HIMS talking about a whole group of men that are now getting erectile dysfunction problems. And here's the thing: when you stop it, some men get post-finasteride syndrome, which is literally they don't get erections again. That's it. Like they're still not getting it after they come off a year. I've had patients in practice, they come off for a year, they still have a hard time getting erections. So I am not a big fan of using finasteride. It's not that I don't. I'll use it more commonly in my women than my men because women also need finasteride. If the testosterone goes up, they create a lot of DHT, they have hair loss, they need it. But for men, it's more common. This male pattern baldness is super common. So why did HIMS do so well in the beginning? They did, dick pills and hair pills. And what do men care about? Our dick size and our hair.
Yeah, there you go.
Right? That's our thing, right, ladies? I think women. We know you care about your face. You care about the face, beauty, all this. We have two things we care about. That's it. That was my hair. Or keep everything going down there. That's like our
And,
manliness.
and how about exosomes? Like
Oh, I
there's
love
some,
exosomes.
yeah. Yeah,
Yeah,
talk
I
to us
love.
about that. What is that? Let's
Yeah.
talk a little
So
about
exosomes are pretty cool. Exosomes stem cells. So exosomes, you can get a roller. Oh my
dermal
gosh, what are the
roller.
dermal. You can do that and you can roll it in there and you can roll the exosomes. So exosomes are basically, oh my gosh, it's so great. The best
And we're not
anti-inflammatory you can
talking about
possibly.
like goji berry exosomes. We're talking about the real deal biologics, right? Like,
Goji berry has exosomes? Okay, did not
no,
know
no,
that.
they do. There's plant-based like there's a lot of advertisements around exosomes. We're talking about the
See,
real.
this is the area that women know more than me about skincare and all of this stuff. I don't know this stuff.
We're talking
What I
about the
can't,
live cultures, the
the
real.
live, yes, yes, yes. So exosomes coming from usually placental tissue, harvested placental tissue. So baby was born, they found the placenta, they took it out, they got it, and they made exosomes from it. Stem cells are what we find in placental tissue. What comes off of these stem cells are signaling molecules called exosomes, similar to peptides. They signal the body to do different things. So exosomes are just signaling molecules, signaling things, repair, recovery, inflammation going down. Those are the big things we see. So you can utilize exosomes in the hair and improve the hair growth. Similar to doing PRP. So if anyone's looked into platelet-rich plasma, platelet-rich fibrin for their hair and getting injections, you can use that, or exosomes actually work even better. What we're trying to do is bring down inflammation at the hair follicle level and help bring the hair follicle back. So you can bring the hair follicle back, you can start to see some hair growth. If you look at before and after exosomes on the head, so anyone out there wants to know, just Google exosomes for the head, hair, before and after. You'll see plenty of pictures of clinics that have posted this, and there's so much information. I always tell people exosomes are the top dog in the room when it comes to hair restoration before you go get your hair transplant, which is another thing that a lot of men want to do. And I will tell you, exosomes are one of the best things you can possibly do for that. Typically, they're equivalent to about 4 of these PRP injections that we do in the head. One exosomes will take up for that 4 treatments you don't have to do.
Jason coming soon to LEMD, maybe.
No, no. Yes, I know.
We'll talk.
Um, we'll talk. Yeah, so this is great. I mean, I love it. Here's the thing, men, we want to feel better. We want to be but what do women want? What do men want? We want more men. We want more men. And I'll tell you right now, bringing hormone levels back is one of the ways to make men men again. Getting some testosterone in most men will improve overall how they feel. I mean, testosterone is our life force for both men and women. Honestly, women, you guys need as much as we do. I mean, a man telling you need testosterone as a woman, I can understand that's a little off-putting, but I can tell you need as much as I do. But my men out there, my women out there that have a man to life, please have this person in your life get checked for testosterone. Is the thing that's going to bring this person back to being how they used to be. They're more outgoing, they did more, they're more active. Testosterone is absolutely massive for me. Growth hormone peptides is another big thing. Pushing growth hormone can help improve your testosterone levels, kind of roundabout because it makes everything work better. You start losing weight, you start getting better sleep, testosterone levels go up. So I'm telling you, there's a ton of things we can do for men. Testosterone, we can help their hair. We can need to get them to tadalafil with PT141 that I know we're using right now and pushing this month. Men want to have better erections, they want to have better sex, right? Women want that for the men. So I do have a lot of things out there that I think men are missing out on. I think there's just this, like you said, this 40s. You hit your 40s and all of a sudden it's like, I'm old. Shit, what happened? We hit 30s. Every woman hits 30 and they're like, oh God, it's all downhill now. And then you hit your 40s, like, oh shit, it's even worse now. I'm 40. And from then, we don't hit that 30. We don't hit that 30 mark and like, oh God, we're old. For us, it's 40. When we hit 40, we're like, oh shit, I'm old. What happened? You start to go in that maybe you've had kids, you got the dad body. Look in the mirror, and you're like, I don't like how I look. I don't like how I feel. This doesn't feel good. And they're looking for who can help them. Is your PCP helping you? No. Because most of these men are seeing the doctors. They're not seeing the doctors. They even care, right? They're not going to go see someone because they don't even know who to go see. And so they have to find someone that they can trust to work with them and tell them and teach them. And women out there, you need to get your man out there and say, hey, by the way, let's get your testosterone level checked. Let's get your growth hormone checked. Let's get your thyroid checked. Let's do these hormones and see what's going on under the hood and see if there's something we can do to help this. So, and again, I always tell people the levels in these hormone labs are massive. They encompass 95% of people out there. Only 5%, 2.5% at the top, 2.5% at the bottom are out of range. This does not mean that 95% of people feel great or have great levels. That just means the population is this. So when these lab companies do this, they develop these tests, they're meant to be 95% of the population. Anything outside of that, we treat. So a man with low testosterone or low in testosterone that's maybe in the 300s still is going to feel terrible to a guy who's maybe below the range and can get covered or have a doctor prescribe it. And you still have the symptoms. Even though you're still in that range, you still have low symptoms or low testosterone symptoms. So I do encourage anyone out there that's listening, get your partner in to get your hormones checked, get your own hormones checked. Help yourself feel better. Unfortunately, medicine right now is a do-it-yourself kind of thing. A lot of do-it-yourself going on. ChatGPT, Gemini. I mean, you name Grok, you can name one of these things we're using, and we're googling ourselves. I mean, how many people out here has used ChatGPT and said, "I feel this right now. What's going on?" Right? I mean, we all do it, right? I do it in practice. I understand, right? We all utilize these AI companions now to help us, and I just think that especially for men, we don't seek healthcare. So we don't know what to do. We don't feel good. We just don't feel good. I've been to come see me. I've been feeling this way for 5 years. Why interested 5 years ago? Oh, well, it finally told me to come and see you. So I guess I'm here now. And then 2 months later, like, I feel great. Why didn't I do this 5 years ago? I don't know. So anyone out there is listening, you got a man in your life, tell them to get their hormones checked, help them feel a little better, and push them to do something to make themselves kind of push to the next level.
I was going to ask that. We have 5 minutes left, and we have a lot of women on this call, and a lot of us have spouses, partners, brothers, siblings, male in our life. What can we do to play our role in our part? You mentioned men
Hmm.
feeling more masculine and manly. Where and what can we do to help assist with that? Do you have any advice for us? How we can support our men to
Hold
on
us
their
and cuddle
longevity
us and tell
journey?
us Hold us and
Is
cuddle us
that
and
what
tell
you
us we're
need?
amazing. We're the best thing in the world. You're so strong. You're so amazing. You just feed our ego, right? Men love to have our ego
Is
fed.
that,
We
is that
love
what
we
you
love to
guys
feel that.
think? Got it.
And
Noted.
then throw in, by the way, babe, you've been so strong, but hmm, maybe we should go get a hormones check together. Maybe we should do that as like a date. We should go to get a hormones check. We should see how we're feeling. You know what? Because don't you remember when we used to take these adventures together? We used to do these things. We should get back to that. I mean, how have you been feeling? Like, talk to your partner. Communication is number one. Talk to them. Ask them what the pain points. I ask every patient, what's your pain point in health? What do you want to do? What do you care about? And of course, because I'm a practitioner, people open up to me and like, I don't really have anything. You dig a little deeper. What's your afternoon fatigue? Like, oh, well, I guess I am tired in the afternoon. I don't like feel like doing the stuff I used to. Yeah, I'm not really as strong in the gym. Like these things start to come out. So you have to be very goal directed. And again, a woman gets a hangnail, she's in the ER. This is hurting. Fix me. A man can have a nail through his hand. He can say, "Oh, I can it's be fine. Like give it a week. If it starts to get black, I'll consider going to the hospital." Men don't like asking for help. We are terrible, terrible at it, ladies. Terrible. I think you all know that. We don't like to ask for him to help us. So sometimes it takes our partner to be like, "Hey, babe, I see you're struggling, but like just talk about it. Let's just communicate. Pull them out of their shell. Ask them questions. I know sometimes men don't want to communicate, but you have to work on communicating with them and explaining to them the benefits. You know, maybe finding someone on Instagram like me who talks about testosterone. You can be like, hey, you should randomly send a video. Oh my God, babe, like look at this. You can go back to the gym and have that six pack you wanted and used to have. Like, don't you want to have that again? Oh my God, remember how great you felt? So feed our egos. That's all you have to do. And then,
Share Dr.
just
Pentek's videos. Got it.
there you go.
Noted.
I mean, if
Aw.
you want, for sure.
Well, thank you. No, thank you so, so much, Dr. Pensek, for coming on and educating our community. This is the best part of what we do here. So thank you so much for taking time out of your day. It's really late where you are. You're in Rio. I think it's like 8,
9
9
p.m.,
o'clock, 9 p.m.
9 o'clock,
So
10
thank
now,
you
but
so
yes,
much for committing to this mission that we have of
of
educating
course.
communities. And thank you all for tuning in tonight, sharing your evening with us. We love this. Jason, I hope you'll be back very soon. And I hope you feel better. Uh-huh.
If
Get
I
some of
miss an
that
alpha one, we're good.
TA1.
I'm just taking all of it.
I know. And I noticed that Diet Coke, by the way. Put that away.
Coke Zero, Coke
Coke
Zero, Coke Zero. So,
Oh, well, thank you so much. Thank you, everyone. Thank you, thank you, thank you so much. Have a wonderful evening, and we'll see you back next month on another episode of our Men's Health series. Thank you, everyone. Good night. Mwah.